Miss Jacobson. I'm Brittany. I'll be your nurse today. How are you?
Good, how are you?
I'm good. Okay, so we saw you in here a couple days ago. You were complaining about shortness of breath, weakness, being really tired. Are you still having these feelings?
Yes.
Okay. Well, while you're here, we did a few tests. We drew some blood. Am I correct?
Yeah.
Okay. We tested that blood, and we took a complete blood count, and we noticed that your iron level is a little bit lower than we would like them to be.
Okay.
Normal levels would be from about 12.3 to 15.3, and right now you're a little bit low at 9.8, which is not good, obviously.
What causes that?
Okay, well, there's many things that can cause your iron to be a little bit lower. First of all, like, what's your diet usually like?
Well, I just became a vegetarian. I still eat eggs and dairy products, so I eat like a lot of yogurt and drink a lot of milk, and
Okay.
I go to Starbucks every day. So.
Okay. All right, that's cool. Well, those things can usually cause you to be a little less on the iron side. Calcium and dairy products, and especially caffeine, can cause your body to not absorb iron as well as it should.
Okay.
Another thing that could cause you to be iron deficient would be excessive exercise. What's your exercise routine like?
Well, I'm a long distance runner, so I run like 3 times a week, long distance.
Okay. Yeah, exercise, like I said, can lower your iron just in the fact that your body's using so much more energy and so many more nutrients while you're exercising. As well as I've read that as you're running, your feet hit the ground so hard it can rupture red blood cells and really lower your red blood cell count, which correlates with a low iron.
Okay.
So,
So can I still run, or?
For right now, I would say cut back maybe, just until your body restores back to normal iron levels. So just start slow. Eventually you'll be able to work yourself back up to where you were.
Okay.
In order to get yourself back to where you were, I'm going to need you to change your diet a little bit. Being a vegetarian is fine, but we're going to need you to start eating less dairy products. You don't need to cut it out completely, but just cut back on the dairy and add more like greens, spinach, lettuce, green beans to your diet to help increase that iron that you've got. And then also we're going to have you start taking some iron pills.
Okay.
Now these iron pills, it's just like a vitamin. It's not like a prescription. We have some here for you. These pills, you'll take them once a day. You want to try to take them with a meal because they can cause you to feel a little nauseous, upset your stomach maybe a little bit. So just make sure you take it with a meal. For the first week or so, you might feel a little constipated, have that upset stomach, but just keep taking them. Eventually your body will get used to it, and eventually your body will restore all that iron that you need.
Okay.
So yeah, just start taking these, once a day, whether it's in the morning with breakfast or at night after dinner, whatever's most convenient for you.
Okay.
Let's see. Do you have any questions for me that I can answer for you?
I don't think so.
No? Okay. So, I'm going to have you tell me what you need to change in your lifestyle.
I need to stop drinking so much coffee
Yeah.
and taking so much dairy products, and I need to take iron pills.
Right. Okay. So how many iron pills do you take a day?
1.
With
Food.
Great. Okay. So, I've also got some pamphlets and a couple handouts here for you. This one just gives you a little information about iron, what it does for your body, some of the signs and symptoms that you would have if you're low in iron.
Okay.
I would recommend just reading over this. I've got a few other handouts to give you about what exercise can do. It's really good to know about your body and what it's going through, so I would recommend taking that.
Okay.
And if you don't have any questions, I will see you back in probably a couple months to reassess your iron levels and to see if we can get you off those pills, all right?
Okay. Thank you.
Thanks, Ms. Jacobson. Have a good day.
You too.